Hello everyone, and welcome into another episode of Ask the Doctor. Today we have a special guest to discuss medications and prescriptions. Welcome in. Start by introducing yourself.
Hi there, my name is Dana Hickman. I'm a nurse practitioner at Northside Hospital. I am the post-acute care nurse practitioner working with very complex patients to improve health outcomes after discharge from the hospital.
First question, can I bring my medications with me to an appointment?
All Northside practices strongly encourage you to bring an up-to-date home medication list to every appointment. Even better, consider a brown bag review of all of your medications, including your prescribed, over-the-counter, vitamins, supplements, herbal remedies, any creams, patches, drops, inhalers that you use, to your appointment so that we can look for appropriateness as well as potential interactions.
How can I ensure the most current info is with all of my providers?
Anytime a medication that you're taking, prescribed or over-the-counter, is started, stopped, or changed, it is important that you update your list promptly. It is also extremely valuable to keep your medication list with you in your purse, your wallet, on your cell phone, and have it accessible at all times. In addition, it's helpful to share that list with a loved one, a family member, a care partner, or a trusted friend in the event of an emergency. Having that medication list that's accurate is so important, making your visit successful and improving your health outcomes. Lastly, a very important thing is when you go to a provider's office and they ask, have there been any medication changes since your last visit, pause and ask to see the list that they have on their records and compare it to the list that you have with you to identify any discrepancies.
What kind of details should I include on my medicine list?
On your medication list, it's important to have the prescription name, the provider's name who prescribed the medication, the reason you take the medication, the dose, and any special instructions. It is always important if a provider asks you to decrease a dose, instead of taking something twice a day, take it once a day, that you ask them for a new prescription so that your electronic records of your medications will be accurate. Then you can write on the pill bottle of your remaining medications the new directions so that the directions on the bottle match exactly what you're taking.
So when and how should I reevaluate what I'm taking?
As we age, we tend to accumulate medications. With an increased number of medications, we have an increased risk for adverse drug events or side effects. Age-related changes that occur naturally affect how we absorb, use, and eliminate medications, making it extremely important to review your medications on a regular basis with your doctor. To help you have better conversations with your providers, I'd like to give you 3 things to mention when you're going to see your provider. One, if you have a new symptom and you're visiting your doctor, one of the first questions you should ask is, could this symptom be a side effect of any one of the medications I'm currently taking? The second question, are there any of my medications that I may no longer need or are becoming more harmful than beneficial? And the third question is, would a lower dose of my medication prevent some consequences down the road, or is there a safer option for this medication?
What are some ways I can stay on schedule with my medications?
To be able to take your medicines appropriately, consider using memory aids, pill boxes, or blister packs. And on a final note, if your medication schedule gets too complex, alert your provider or speak with a pharmacist about potential ways to simplify your medication regime. Thank you so much for your time. I hope you're now inspired to keep that medication list handy. If there's anything I can do to help you, my name is Dana Hickman. I'm with Northside Hospital, and you feel free to reach out to me with any concerns.
This has been Ask the Doctor, presented by Northside Hospital, Cherokee.